Jefferson Center has been serving the community for 60 years, and it's amazing what has happened in those 60 years. Community has always been at the heart of what we do. The community partnerships that we've built over that time have allowed us to really provide the array of services to individuals and families struggling with mental health issues. And it's also allowed us a chance to sort of have our finger on the pulse of what the needs are within the community.
Go ahead and have a seat.
Over the past few years, we have seen a greater need to really serve individuals struggling with addictions and substance use.
Substance abuse impacts many individuals across all walks of life. It knows no discrimination, and it impacts family, friends, neighbors, and the entire community in a way that wreaks havoc in an individual's life, where they're unable to function the way they would want to function at work or at school. Communities are trying to address and deal with the issues. Law enforcement, hospitals, public health departments are trying to also reach out to individuals who are experiencing addiction, and we want to help people in our community so that we can better treat the problem and strengthen our communities.
My name is Karen Masters. I'm a master's prepared nurse. I have well over 25 years of experience in and around medicine. Here we want to, foster health and healing for those that we serve, and we have a particularly close connection to our community. I think that there is a misconception that substance use is just somebody out there. Substance use is anybody.
Before I got to Jefferson Center, I was barely functioning day to day. I couldn't hold a job. I was so addicted to alcohol that I couldn't function, I couldn't hold a job. My life was out of control. Until I came to the Jefferson Center, I was unable to work, I couldn't function. And now I've had a job for coming up on 3 years. I've gone through a divorce, and after 14 years of being a family, all of a sudden it was broken up and I was kind of on my own. And it was just real heartbreaking, and I kind of gave up. I was drinking every day and having blackouts very frequently and waking up with the shakes, and I was like a tornado. It was chaos. I didn't know if I was going to make it out alive. And I was suicidal, but then there was the part of me that wanted to hang on, especially for my sons. They were my biggest motivation because they need their mother, and a lot of that got me. It was a big motivation to get back on my feet because I want to be there. The Jefferson Center is just amazing, just the different resources they have, the different staff they have. First time in my life I felt like I haven't been given up on. They're just amazing, and they've helped me come so far. Like I said, I didn't know if I was going to be alive day to day, and now I'm actually living a good life.
There was a social detox program in our community very closely affiliated with us. When they decided to close their doors, here's our poor and vulnerable community population that needs that assistance. Where can they go until they are able to make better decisions for themselves and keep themselves safe in the meantime? They decided to close their doors, and now we had a significantly vulnerable population that could not get the care that they needed. And we were so excited when Jefferson Center for Mental Health decided to reach their arms out to partner with us in helping this poor and vulnerable population.
When Jefferson Center was approached to take over the withdrawal management program in Wheat Ridge, we thought it would be a great opportunity to expand what services we currently have, and then to be able to serve the community with law enforcement, hospitals, and the public health department so that we could better serve this population. The center has been providing walk-in and mobile crisis services, and also has been a part of the Colorado Crisis Services, and continues to provide those services. And co-locating that program with withdrawal management gives us an opportunity for a single point of entry to address both mental health and substance use treatment, and to allow our community to be able to go to one place to provide the triage for those individuals.
No one asks to struggle with mental health issues. No one asks to struggle with addictions. So we want to make sure that when an individual is ready to seek treatment, to ask for help, to start their path towards recovery, that Jefferson Center is here and that our doors are open. Mental health is something that we've been talking about over the past 60 years. It's been a part of what we do. It's been a part of our mission. But something that is equally important to talk about is substance use and addictions. And it's something that we are committed to destigmatizing in a way that we've been working passionately around mental health issues for 60 years. And now it's time to say that there is no need to have secrecy or shame around addictions either.
So my own personal experience is what brought me to this field, and I believe that addiction impacts many people, family, friends, neighbors, and that is why we're here. We know that we can treat substance use, that it is treatable, and that we're able to help and give hope and empower individuals to live a long, sober life.
Without Jefferson Center for Mental Health, I don't even want to think about that.
No one is immune from struggling with mental health and addictions. And so many of us have our own stories about people that we know, people that we love, people that we've lost to addiction. And I'm not immune from that either. My brother died less than a year ago from a drug overdose. He had just gotten out of a social detox facility in Florida and was waiting to go into a residential treatment center, and had one last go, and that was the last time that he would use drugs.
There is hope. There is hope. I thought I was hopeless and worthless and all that. Now I've got hope today. And so much. There's so much that has changed, and so much to look forward to.
If we could have the services that people need when they need them, and they don't have to wait when they're ready, how many more people could we save?